Everyone, we're just going to give it a couple of seconds for everybody to come in. See that a couple of people are still in the waiting room. In the meantime, if you are joining us for the first time, welcome to Epidemics of Injustice, Health Equity for Everybody. If you could please check in either using the QR code on the screen, or if you just go ahead and click on the link that Marjorie has placed on the chat, we'd greatly appreciate it. And there will be time for questions at the end. I think everybody should be in. Just as a reminder, you were all muted upon entry. If you're on a phone line, please just make sure that you are muted. And just as also another reminder, my name is Wendy Avila. I'm one of the instructors, and here are the other instructors of the course. And if you are new, Epidemics of Injustice is a class that was created because of student leadership in radical public health, and now it's sponsored by the Collaboratory, where we are trying to bring community voices to the forefront across the School of Public Health. You're more than welcome to click on the link for the Collaboratory of Health Justice, or just Google them to find more information on their website. And also too, if I forgot to mention, if you could go ahead and introduce yourselves with your names and your pronouns in the chat, we'd greatly appreciate that. And just to give you a little bit of an outlook for the community guidelines, these are the expectations that we uphold for both our community members and our students. And we ask you to listen with an open mind, to have mutual respect and appreciation for one another, to respect the privacy and personal information shared in this space, to let everyone participate, and just as a note, disruptive and disrespectful language will not be tolerated and will result in the removal of the class session. We also know that a lot of the lectures contain material that might be difficult to discuss, so please feel free to step away if you need to take care of yourself during the presentation. And the University of Illinois at Chicago stands on the original homelands of the Miami 3 Fire peoples, the Ojibwe, Ottawa, and Potawatomi, who have been stewards of this land for generations. Illinois is also the home to a diverse Native community of more than 75,000 tribal members, many of whom live in the Chicago area. For those who are not currently residing in the Chicago area, we highly encourage you to look into the Indigenous people of your own lands. And it's with great pleasure that I'm here to introduce our speaker and presenter for today, Zoë Harris, who is also a co-instructor for the course. And Zoë Harris is a community health sciences PhD student at the UIC School of Public Health. Zoë is a citizen of the Mashpee, Zoë, if I'm saying this wrong, please correct me, Wampanoag tribe, and has worked with her own tribal community as well as urban Native populations in Boston and Chicago on topics of education, health promotion, and language preservation, specifically among youth populations. Zoe's also a Jamaican citizen and has family roots in Selma, Alabama. Therefore, she strives to educate people on the unique experience of Afro-Indigenous people to shed light on lateral oppression that exists in these communities. In addition to her work on Indigenous wellness systems, she has also worked on projects related to suicide prevention, social determinants of health, and racism as a public health issue. Additionally, Michelle Napoli is also here and will be doing the art lecture later this evening. And although the community member, and we just encourage students to stay on for that second half to be able to take part of that action lab piece. Zoe, I will go ahead and turn it over to you.
Thanks, Wendy. And you were close, it's Wampanoag.
Thank you.
I should have put the it in there, it's fine. All right, I'm going to share my screen really quickly and then we will get started. How's everybody feeling today? I know it's the end of the week, it's Thursday. I'm tired, but I'm excited to be here. All right. So again, thanks for showing up today. We really appreciate it. And I'm excited to talk to you all about Indigenous health today, and then also to have Michelle supplement this later this evening. So this is what we're going to be talking about. I'm going to give you a brief background on Indigenous health, mostly focusing on the United States, then really going into current health disparities, and then finally ending with Indigenous health and art and what that kind of means specifically for Indigenous people. So I'm going to start really basic. What does Indigenous mean? What does Native American mean? I like to use Office of Minority Health. I like to use federal definitions because I feel like those really show you a population level about who's affected. So Indigenous is originating or occurring naturally in a particular place or native. And Native American is people having origins in any of the original peoples of North, South America, and Central America who maintain tribal affiliation or community attachment. So what is federal recognition? So there are a lot of different tribal nations throughout the United States, but there is a difference between a federally recognized tribe and a state recognized tribe. And this is a really long definition, but the crux of it is that federally recognized tribes have a government-to-government relationship with the United States. So they are able to get federal benefits and services from the United States, like health services, education benefits, that members of state-recognized tribes or unenrolled members are not able to get access to. And just to kind of give you a broad look of what Indian country is, or also known as Turtle Island, it's everywhere. So this map is from Native Land CA. It's also an interactive map. So if you go online, you can look up where you live and you can find out exactly where the people are. They're also really good about showing if that tribe is still existing and also information about how to get in contact with them. So we always say at the beginning of our lectures, we encourage you to look into it. So if you haven't done it yet, this is where you can go to do that. So what exactly does federal recognition mean and what does it not mean? So like I said, if you're a member of a federally recognized tribe, you can access healthcare. So there's a thing called the Indian Health Services, which is government sponsored. And if you are a member, you can access that. There are also education benefits, housing benefits, and several other things that are a little too complicated to go in here. But the realities of this federal recognition process is that it really reflects on and contributes to the forced assimilation of Native people. And that's because it has a lot to do with things about blood quantum. So a lot of people need to have a certain percentage of Indian blood in order to be on a tribal roll, or it has to deal with descendancy and people being forced off their lands. And especially for youth in particular, it can create a real conflict for people because maybe they grew up on their tribal lands, but because they don't have a certain blood quantum, they can't be an enrolled member of their tribe. So they have all these cultural traditions, but the government is telling them that they can't have any of the benefits of that. So a really brief look. So who exactly is this affecting? So in 2019, 5.7 million people identified as American Indian Alaska Native alone or in combination with another ethnicity. And most people actually live outside of their tribal statistics, and most people live in an urban area. So they don't live on their tribal lands anymore. And a majority of people are actually under the age of 18. So this is a very young population. I want to talk a little bit more about urban natives and what urban natives are, because people that live in urban environments are a little bit different than people that live on their homelands or in more rural territories. So there are some people that are long-term residents or forced residents. So there was something called the Indian Relocation Act. And essentially what happened is Native people were, I don't want to say encouraged, but they were told that they should go to cities, but the idea was to break up communities more and more. So some people moved here for that particular reason. Some people moved for other reasons, jobs, family, things like that. And then there's medium and short-term visitors. So there's people like me. So I moved here for school. A lot of people move for school. Some people are, again, just there for a short period of time. But urban communities are really diverse, from people that have been there their entire lives to people that have maybe just been there for a year or two. And what exactly are the services that support urban natives? So there are American Indian centers. So again, this is the Indian Relocation Act, and they were built as places for natives to build community and support services. And Chicago actually has the oldest American Indian center in the United States. And there are also urban Indian organizations. So I mentioned a little earlier that there's the Indian Health Service, and they provide health services to Native people in the United States. And these organizations in particular are specifically for urban natives, and there are 41 of them currently in the United States. And really just to show you how many Native organizations there are, not even just in the United States, but in Chicago alone, there are so many. I think that sometimes this population can be very invisible, but they are not invisible at all. I am a little biased. Like Wendy said, I'm a member of a tribe, so I have a little more information than other people, but if you want to get involved, I highly recommend that you do that, even if you want to start local. So UIC has a Native American support program, but as I mentioned, American Indian Center is here. Chicago American Indian Collaborative really brings all these people together. Chicago Public Schools has an Indian education program. So there are a lot of opportunities to learn more about Native culture right here in Chicago. Next, I want to talk about intersectionality, which is something that we've talked about kind of briefly in our other lectures, but I think is really important here because, as I said, a lot of people, yes, they identify as American Indian, but they also identify as something else. So I really like this graphic and I'll read it really quickly. So this is Intersectionality, a Fun Guide. So this is Jess, and Jess is a stripy red triangle and should be proud. Sadly, some people don't like Jess. Jess faces oppression for being a triangle and for having stripes. But luckily, there are liberation groups. But because they aren't intersectional, they look like this. So they have one group that's just triangles and they have another one that's just stripes. And these groups don't talk to each other. And in fact, they compete. And Jess doesn't know where they should go. And Jess just wishes that the triangles and the stripes could work things out together. And essentially this boils down to is that intersectionality is the belief that oppressions are interlinked and they can't be solved alone and they are not isolated from one another. So try to illustrate this a little bit more. So this is the breakdown in numbers. So again, about half of people just identify as American Indian, Alaska Native, but more than half, a little bit more than half identify with something else. So this is one graph that's just population of 2 or more races. So we have most people identify as white and American Indian, Alaska Native, about 83%. About 8% of this Native population identifies as Black and Native. We have Asian and Native, and you can see all these other ones. This next graph is honestly a mess, and I don't expect you to try and read all of these, but this is really just to illustrate how diverse Native people are. They can be white, Black, and Native. They can be Asian, Native, and Native Hawaiian. And this is a lot, this is 1 million people that have these intersectionalities. And that's why we cannot separate them from one another. Their indigeneity is not separate from them being white. It's not separate from them being Asian or Black or anything. It's all within them as one person. So now talking a little bit more about the health disparities. So this is just a really brief overlook of what it looks like. So on the left-hand side, we have the Native statistics, and on the right-hand side, we have the non-Hispanic white statistics. So I'm not going to read all of them, but just, at a brief look, you can see that at least 84.4% of Natives have a high school diploma compared to 93%. Or the median household income for Natives is under $50,000, where it's about $70,000 for whites. Unemployment rates are really high. Uninsured rate is really high. It's more than twice what it is for Natives. And again, it's really hard to support this group if you don't have that data. So looking at this really helps to understand that more. Here's a little bit more, some all-cause mortality rates. The ones that I'll point out in particular are accidents. So Natives have a really high mortality rate from accidents. There's a really high rate of diabetes, really high alcohol-induced cause of death, and then also chronic liver and cirrhosis. I know that everybody's tired of hearing about COVID-19, but I feel like I have to talk about it because it hit the Native community really hard. So Navajo Nation in particular, it's the largest reservation in the United States. It takes up parts of New Mexico and Arizona, but they had more per capita deaths than any other United States. And even though Native people only make up 9% of New Mexico, they were 75% of the COVID deaths. And that's really because there's a lot of overcrowding and the Indian Health Service is underfunded and it's under-resourced. And as you can see here, far less money is spent on healthcare for Native people than it is compared to the larger US healthcare system. This is a more recent graphic about cases and hospitalizations. But again, you can see that not only compared to whites, but also compared to other racial groups, Native people have higher rates of cases, hospitalization, as well as death. This is all very doom and gloom. So I definitely want to give some vaccination or some successes when it's come to COVID-19. So what's been really great is the prioritization of elders and language keepers and cultural bearers. So I thought this was a really great example of tribes being given their sovereignty, meaning that they have the ability to make decisions on their own about their health and their policies. So a lot of tribes chose their own way to distribute vaccines, and their priority was, we want to make sure that our elders, the people that are cultural bearers, so our medicine people, are getting those vaccines first. So as of about a week ago, IHS has administered over 2 million vaccines to the Native community. We have really, really high vaccination rates. So Navajo Nation, 70%, Blackfeet in Montana is 95%, Sac and Fox in Mississippi, 70%. So really, really great vaccination rates. And one of the really great examples I liked during the pandemic, although it's still going on, is that the Cherokee, the Chickasaw, the Osage, the Choctaw, and Citizen Potawatomi nations actually expanded their vaccine eligibility to the entire state of Oklahoma before Oklahoma was even ready to give vaccines to people. So Oklahoma was only at stage 3, so it wasn't open to the general public yet. But these tribes were like, you know what, we have made sure that everyone in our communities are safe, and we also recognize that our communities interact with the larger state of Oklahoma. So in order to protect our people, we're going to continue to spread the wealth. I just think it's a really great example of Native wellness and Native brilliance, and just showing how, you know, even though Native people might seem invisible, that we are not invisible. And this is a really great example of that. Again, this is just a really great graphic just showing how important vaccination has been to this community, which is also not particularly surprising, considering that for a very long time, disease has been used as a way to commit genocide against this people, all the way back to the 1600s when colonizers first came here. Yellow fever, smallpox wiped out our communities, and I think that this really shows how we have come back from that. This slide is really busy, but I couldn't take anything out of it because all this information is important. So suicide is the second leading cause of death for Native young adults, so between ages of 10 and 34. Natives are more likely to feel like everything is an effort, so they have more symptoms of depression and anxiety. The overall death rate from suicide is 20% higher for Natives compared to non-Hispanic whites. And these are the statistics that really just kind of hurt for me. So Native females, 15 to 19, have a death rate 5 times higher. Native males, 15 to 24, have a death rate 2 times higher. And these accidental deaths, so violent death, unintentional injury, homicide, suicide, they make up 75% of all mortality for people who are in their 20s as Native people. And like I mentioned earlier, Native people have a really high percentage of young people. Almost 30% of the Native population is under 18. And these are the statistics that they have waiting for them right now. So now I want to talk about missing data. And I just, showed you all of these statistics about, how mental health is really bad in these communities. It's causing not only morbidity, mortality. And this is CDC data. This is from the Office of Minority Health. And even though we know that people in their 20s are dying from suicide, they just don't report data on suicidal ideation in grades 9 to 12. It's just not there. They just don't have the data on the major depressive episodes among American Indian and Alaska Natives. And I think we'll talk about this, towards the end of the semester when we do a session on radical statistics. But it's also something we've talked about in other lectures. If you don't count it, if you don't name it, then how can you fix it? If you don't have the numbers in a place where you always need the numbers in order to make change, how can you fix it? This is more of a lighthearted one, although it's not lighthearted, but this is a CNN exit poll when in the 2020 election. So they have white, Latino, Black, Asian, and then something else. I don't know what something else means. Technically, I would fall into the something else category. I know plenty of other people would fall into the something else category. But again, it's really just the erasure. And it doesn't just happen on the federal level. It happens at UIC, it happens all over the place. And we really just need to make sure that we are not intentionally or unintentionally erasing this population, because we are still here. So I want to talk a little bit more about historical trauma and what historical trauma is. So I am going to read this particular definition. So it's the cumulative emotional and psychological wounding over the lifespan and across generations emanating from massive group trauma experiences. Historical trauma response is the constellation of features in reaction to historical trauma, which can be substance abuse, depression, anxiety, low self-esteem, and the difficulties to express and recognize emotion. And I put this up here because I didn't talk a lot about the history of Native people, because that's definitely out of the hour that we have in this class, but there's just a hundreds and hundreds of long years history of Native people being systematically exploited in a ongoing genocide against Native people. And that has psychological and physical effects on people. The example that I will bring up is Indian boarding school. So I'm sure that some of you have probably heard about it in the news about these children who were found in just mass graves. And luckily, many of them have been brought back to their homelands. But some people did not die there and they were able to escape that, but that trauma that they have is passed on to their children and their children and their children, and it just continues to be compounded. Fortunately, there are ways to combat this. So things like developing support systems and connecting people to their culture and these multi-level practices and intervention that really holistically address historical trauma. And what I kind of want to point on in particular is that these things that are countering it are inherently Indigenous wellness. These are not new ideas. These are things that Native people have been doing for centuries. And it's just because of the systematic breaking of these communities that they no longer are doing it. So it's really just Indigenous people going back to what they always do and have always known. So now I'm going to go into a little more lighthearted things. So I'm going to talk more about Indigenous health and art. So what is art therapy? So art therapy is an integrative mental health and human services profession. It's used a lot in psychological theory, but it helps with social skills, reducing conflict, emotional resilience. This is the American Art Therapy Association definition. But again, I just want to say that this is the technical definition, and this is what Western society has named it, but art is wellness. Native people know that art is wellness. So I'm putting this up here, but I just want you to remember that art is wellness for Indigenous people and for everybody, really. So these are just some examples of traditional art in Native populations. So jewelry making is really big, making clothing is really big, so specifically regalia. Regalia is typically used for ceremony and for dance and things like that. Painting, textiles, beadwork. Beadwork is a huge thing. And also it's other things. It's not always a physical thing. So sometimes it's dancing, sometimes it's singing, it's drumming, it's prayer, it's storytelling. So, sitting down with your community and sharing stories with people. Again, it's ceremony, it's symbolism. It's more than just, playing with Play-Doh. So here's a really quick overview of art therapy. So art therapy has been used in a lot of different communities. So from people with Alzheimer's to children with cancer, youth refugees, just a really wide range of populations. But in all of these situations, it improves people's mental health, it helps them to communicate, it gives them coping skills, and it just makes people happy. It just brings them joy. So the thing about art therapy is that, nobody really knows how it works. And that's kind of one of the things that I like about Native and Indigenous brilliance, is that, you don't need to know why it works, you just know that it works. But these are still some ways that people have tried to kind of evaluate it in the past. So, general theoretical principles, measuring people's cortisol, so how stressed they are. So measuring it, it's like, okay, their cortisol is really high before doing the art, and afterwards it's much lower. Sometimes they'll actually code the art, so look at the themes that people are talking about in their artwork. Sometimes they do clinical assessments. So, sorry, I'm gonna wait for the fire truck to go by. The beauty of living in the city. But so quantitative assessments, so measuring people's levels of stress or depression, imposter syndrome, things like that. So earlier I talked about missing data, but I'm going to fill in the gap for you because the data is out there. It's just not on these big federal websites. So again, kind of a lot of information, but at the crux of it, Native youth have really high amount of anxiety and depression symptoms compared to white youth. They have a greater disease burden. They also typically have more anxiety symptoms in general. And this was based on the Children's Anxiety and Depression Scale. Also, they have higher levels of stress. So they feel like they have difficulty coping with their stress, and then that results in negative coping behaviors. So having substance use, violent acts, things like that. But on the other end, people that have positive coping strategies, not only are they able to deal with the stress in more positive ways, but they also feel better. They are more involved in their community. They have less mental health symptoms. They feel more confident. They feel more disciplined. They really want to get involved in their communities. So even though, there are really high levels of stress and anxiety in this community, there are ways to fix it. And kind of just the common thread is throughout many studies on stress and anxiety and depression in youth in particular, it's really improvements to healthcare to address the disparities, so increasing access, and then having targeted culturally responsive interventions. So working specifically with tribal communities, whether it's a specific tribe or with an urban community, to make sure that the intervention that they have actually makes sense for the community that you're working for. Which, it can seem like, oh, well, this is really hard. I mentioned earlier, there are 574 just federally recognized tribes. How can you make an intervention for every single group? Well, it's possible. Just ask them. Just because they're a small community doesn't mean that their community does not matter. So I really like this wellness model. So I think that this kind of goes back to what I was talking about, how all of Indigenous wellness is wellness, art is wellness, being Indigenous and doing those Indigenous practices is wellness. So we have culture and family. So that has to do, again, with the ceremony I was talking about, the literature, sharing stories, but then you also have your creative expression. So whether that's, you do dancing or you do storytelling, and that directly feeds into your wellness, and they all interact with each other. And it just creates an environment, not only for you, but for everybody else, that is just community connectedness. And when you have that, you can spread it to everybody else through your own knowledge and attitudes and behaviors. This was actually one of the articles that we posted. So if you didn't read it, I highly encourage you to go and read it. It's a great read. So now I'm going to give you some examples of our interventions over the years. So this is an older example, but this is a case study of a man named Marcus, obviously not his real name, but he identified as Native and Caucasian, and he also was LGBTQ. So he used his art to reflect both on his Native identity, but also he had an HIV diagnosis. So he was able to use his art to express his stress and his anxiety, but also his own connection to community. But that was through his art. Sometimes he felt like he didn't have the words to say it, but he was able to show it through his art. So for example, he has this picture of his pain and emotion. He also has a picture of one of his dreams. He has positive and negative reinforcement from his family. So this is just one case study, but I'm going to show some more examples. This is another one, which was specifically for Indigenous cancer survivors and their family. So this one is kind of a mix of mediums. So this person on the left used some clay to create a cancer cell, but you also have some more drawings on the right-hand side. But after this intervention, they felt not only could they talk about their cancer diagnosis, so that other piece of health, but also about their own native healing and their mind and their spirit. And that was just through this 1 3-hour art therapy workshop. This is another example. So this is a dissertation that was done called the Moccasin Project. So they use moccasins, which is a common, I don't want to say symbol, but it's a common symbol in Native culture. Most Native tribes have their own version of a moccasin, but people use moccasins to talk about place. So in here, the acronym is people, land, ancestry, culture, and experience. And this is an example of an Indigenous methodology called story work. So using a story to talk about the work that you're doing, essentially. And I also like this intervention because not only did it have the art piece, but it also filled in small gaps. It was a wraparound. So for example, they gave people gas vouchers so that they could go to the event and actually participate in it. Because, you can do an event, but if nobody can show up, then what's the point? This is another example. This is a case study of a girl named Maria. So she had been in foster care since she was 11, and then she was transferred to a residential treatment program. And she used more of the clay bases. So she was able to talk about her culture and her identity and her past trauma of being in foster care through this art-based program. Another example, so this is a community-based workshop. So this had a group of people from 12 to 85, so from youth all the way up to elders. I actually really like that because in Indigenous cultures, you really try to make sure that everybody is involved, especially having the youth learn from the elders in the community. So I really like this example, but this has a lot of mediums. So there's people playing with clay, but there's also painting, people using markers. And again, those same themes of being involved in your community and talking about your connection to nature and how you're dealing with these other negative coping strategies. So like substance use and how all those things are interconnected with one another. So now I'm going to talk a little bit more about my own tribal community. So again, as I mentioned before, I'm a citizen of the Mashpee Wampanoag tribe, which is based on the East Coast. And our language project in particular, the Wampanoag Language Reclamation Project, has done a lot of really great work with language revitalization. So our language is actually dead for about 100 years. We didn't have any living speakers. And Jesse Littledoe, who's the founder of the organization, helped to bring the language back. And it's been an ongoing process. So that was in the 90s. And since then, they've opened a preschool, they have summer camps, they have language classes for people. It's just a really vibrant community within a community. And part of that reclamation project has been to do books. So having books that can be read with children and with their parents so that the parent can learn the language and also the child can learn it, because what we definitely learned is that children are way better at learning language than adults are. So it really helps both of them to learn about it. But also what's been done is doing health education with it. And this is not particularly art therapy, but I'm really just going to talk about it again and again. Even though it's not art therapy, art is wellness. Being involved in your community and doing things that are important to you is wellness. And just because you don't maybe understand how it works doesn't mean that it doesn't work. So this is one book in particular. So this is called Ruby Machinau. It's by Tia Pockmet, who's one of the language teachers. And it's about Ruby, and she gets sick, and her grandmother has her put onions in her shoes, or in her socks while she's sleeping. And the next day, the onions are all black, but she feels better, and Ruby feels better, and she doesn't have a cold anymore. And what I love about this is not only is it illustrated by Tia, but also it's translated into Wampanoag. So there's the English, and then there's the Wampanoag next to it. So it's combining the health part of it, it's combining traditional knowledge, it's combining art, it's combining community, and this is just a really great example. And then another example, just because I'm going to to my own horn. This is my master's thesis. So it's which means a walk through the woods. And I worked with my tribal community on this for a very long time. So I interviewed with several people, all the way from elders in the community to really young people, about their experiences with traditional medicine. And I used those interviews to inform the narrative of this book. And what I really liked about this book is that not only did it have community involvement, but we actually had the opportunity to create new words. So like I said, our language was not around, people just weren't speaking it. And because of that, we have to create new words, kind of like how the Vatican has to create new Latin words. So they created new words for things like sassafras and willow bark, which are, you know, words that I'm sure were around at one time, but we no longer know them. So having the opportunity to do that work with Jessie Littledoe and also Tracy Kelly, who's another linguist, creating those words was a really great opportunity. And also is a great opportunity for cross collaboration. So Mashpee is just one of several Wampanoag tribes. There's also Aquinnah, which is on Martha's Vineyard, which is one of the islands near my community. So Ella Mahoney, who I've also worked with, she did amazing illustrations for it. So just again, having this great cross communication between the health aspect. So not only were we doing the traditional medicine, but we were talking about healthy eating. We were talking about how singing and drumming and going out and doing shellfishing and clamming, how those all are activities, again, that people, Indigenous people on this land have been doing for centuries. And just because of how Western society has kind of gotten in the way, we've strayed away from it, but going back to it is what makes us healthy. And another aspect that I kind of put into this book is the young boy, he lives in an urban community. So like I said before, 60% of Native people don't actually live on their tribal homelands. So even though, you know, he's able to go home to his tribal lands and hang out with his grandmother, when he goes back to his city, he still does these activities. He still practices singing, he still practices dancing, he still eats his traditional foods. So just really showing people that, yes, you know, a lot of this stuff, you know, I can't go shellfishing in Lake Michigan. That's not going to happen. But I can still continue to do those things in an urban environment, even though people might be telling me otherwise. And that's it. That's all that I have.
Thank you so much. So we do have a couple of questions for you if you want to go ahead and get into that portion. Okay, so I'm gonna just let anybody who wants to come off mute and ask a question first. And if not, then we can move on over to the written questions. Okay, so I'm going to move on then. So the first question that I am going to give you is, so this is actually was just written as you were presenting right now, but do Indian health services account for art therapy and Native wellness?
The short answer is yes. So one program that I know in particular is actually my former employer. So Native American Lifelines is based in Boston and also based in Baltimore. It's an urban community. So again, really harping on that urban natives and urban health. But they have an art therapy program. So they have, I believe, 2 or 3 art therapists. So they do individual art therapy, but they also do group art therapy. And they really have a trauma-informed care, ideology, not only for art therapy, but across the board. And there are plenty of other organizations that do it as well, but that's the one particular example that I have.
Thank you. And I see that, Tambra, you have your hand raised, so I think you're able to unmute. Let me make sure. Yeah, you should be able to and ask your question.
Hi, my name is Tambra, and I'm originally from New Orleans, and I was curious about how does all of this fit in with the Native Americans, mainly the Black Native Americans in New Orleans. We just finished with the Mardi Gras. We see all of the Native Americans, the Indians, because that's a big part of our culture. So I'm trying to figure out how all of this works, because I'm assuming that most people classify the Black Native Americans in New Orleans just as Black, but they don't consider that we have a large population of Native Americans, Black Native Americans. In fact, James Earl Jones considered himself a Black Indian and being raised as a Black Indian. And that's a big culture in New Orleans and in that area.
Yeah, that's a great question. Thanks for asking that. I'm sorry, give me 1 second. My cat is being a menace and I need to deal with that. Okay, thank you. So yes, great question. I may or may not have mentioned it, but I am Afro-Indigenous. So, well, Wendy mentioned it in my biography, but I think that it has been a very long journey and it's not a journey that's over. So I can't speak specifically about New Orleans because I'm not from there, but I do know that the Tunica Biloxi tribe is in Louisiana. I believe it's one of the few federally recognized tribes in Louisiana, but there's been just a lot of work in the Afro-Indigenous community in general to increase that visibility. Because of history in general. Let me think about this, for example. I'm trying to give you an answer without giving you a super long history. But the crux of it is that, yes, I think it's because people are raised as Black, but I think that's why Afro-Indigenous people, especially more recently, have been very loud about themselves and have been like, I am here just because I don't, have tan skin and long braids down to my down my back doesn't mean that I'm not Indigenous. And also it's a reflection of that. It's not your fault. It's not your fault that you might not look like a stereotypical Native. But again, I think a lot of work has been done with that. Actually, very recently, I believe it was, I want to say Cherokee, but it might be Choctaw instead, but there is a group of the 5 tribes that are called the Freedmen. So there were 2 different roles. So there were Cherokee people and then there were Cherokee freedmen. And freedmen were enslaved by the Cherokee and a few other tribes. But they were still Cherokee. They were involved in the traditions, they're involved in the culture, and it's just been a long back and forth between, are they citizens, are they not citizens? And actually within the past couple of weeks or so, they are now considered citizens, and they can take part in all of the, again, benefits that I kind of recognized or talked about that come with federal recognition.
Tambra, I see that your hand is up. I don't know if this was in response to what Zoe's saying, so feel free to come off mute. Okay, I think we can come back to it then.
Right, thank you. You wasn't allowing me to. Yeah, so again, back to that heritage that's there. And actually, a lot of them was not raised as just being Black. From being there, I can tell you when I run across somebody, I will tell them, I say, oh, you from the 7th ward. There's more wards or whatever. And they're very fair complexion with long hair, with the, my grandmother, who was actually dark complexion, and her grandfather was Native American with long hair. Now she was raised mainly Black. But New Orleans is such a unique culture. I just think that something is being missed there, because you have a large group of Native Americans that are not being included in a lot of these discussions. And only time people look at them is during the Mardi Gras, when you can go down to Treme, which most people consider as Black because it's a historical Black area. But again, we consider them Black Indians, and even no matter what complexion they are, because in my family, it can be my complexion, or they can be, basically, they look white. And, the difference in the hair, because I can tell people from the city because of the undertone, the different structure of the hair. It's just different. So I'm kind of figuring out how are we going to bring in this whole group of people that's being missed.
Yeah, I don't know if I have a good answer for you. Unfortunately, it's something that I struggle with all the time, but I would say what I usually tell people to do is just try and learn more. So two books that come to mind are Black Indians and An Afro-Indigenous History of the United States. They're both really good resources. Also, I'm going to plug myself again, but I work for the Native American Support Program, and we just did an event last week actually about Afro-Indigenous people, specifically at UIC, but more generally and how to support them. So if you go to nasp.uic.edu, you can see the link on there too.
Okay, but just to let you know, it's about 38 tribes down there.
Thanks, Tamara.
Thank you.
Okay, so now I have a very long question for you. So I'm going to put it in the chat as well, but it's a two-part question. So what political moves fundamentally atone for the injustices of the past centuries of colonization? What should reparations look like that are not just paying lip service, but are also actively addressing the systems that continue to oppress? And again, I'm posting that in the chat because it is long.
Yes. I don't know if there are any political moves that can atone for the injustices of the past centuries of colonization. I think that I honestly don't know. I feel like a lot of the things that are being done nowadays, like land acknowledgements, and I know that we do one at the beginning, but it's very intentional. We do it because this is an Epidemics of Injustice course, and you know, all the injustice that we talk about specifically in the United States, we're talking about it in the United States because Native people were taken off their land. So every time we talk about an issue in the United States, we need to talk about how people are only here because they have systematically murdered thousands of people over centuries. Realistically, I think it's just putting more resources into these communities and listening to the communities. One of the earlier slides I showed had the IHS statistics, so how much money is spent on people who go to IHS versus those who not. So it's a huge difference. It's $3,000 per person in IHS and almost $10,000 per person, you know, compared to the US average. That's nothing. And like I showed, the health disparities that exist in these communities are not, they're not fake. This community has the highest rate of health disparities. But it's also because it's so intersectional. You know, it's not just the health part, you know. I'll speak about my own tribal community. You know, yes, we have a high rate of diabetes, but it's not because, you know, we don't know how to eat, but our traditional land, it's poisoned. A lot of water that we have done shellfishing in, it's poisoned. So the mussels and the quahogs that we used to eat, we can't eat it anymore. Or the deer that we used to go out and hunt, they're just not there anymore because of all of the land destruction. So even though all these pieces seem separate, they're really not. So I don't know if there's one political move because they're all interconnected with one another. And I think that kind of goes into the what do reparations look like too. At the end of the day, just give us the land back. Is that ever going to happen? I don't think so. But even if it's just, you know, making sure that people's sovereignty is respected. There was a period of time for about, you know, a year or 2 years where my own tribal community was afraid we were going to lose our tribal lands. And the fact that that was even contested, that our land could even be taken away from us, is horrible. So an example that I'll give is that in our language, we talk about like being on the ground. Like when people talk about being removed from their land, like I've literally been taken from the ground and I'm not on my land anymore. Like the connection between these things is just, you just can't separate them. So I'm sorry if that wasn't the answer you're looking for, but the answer is that they just need to get the land back.
Bonnie, I see that your hand is up, so you can go ahead and unmute yourself.
Thank you very much. Zoe, you just mentioned giving the land back. So I wanted to ask about what's happening in Oklahoma. So I had heard that the entire state of Oklahoma, in a court decision, was named tribal land. So what does that mean as far as giving the land back? And, where can the tribal communities and the sovereign nations go from here to get the land back that, we've destroyed?
Yeah, that's a good question. I would say, as it relates to Oklahoma, I guess like a more like to make it more concrete for some people. So when you're on your own tribal land, you can make a lot of decisions for yourself. So a lot of tribal lands have their own tribal police, they have their own tribal courts. They are able to have their own school systems there because they don't have to be within the confines of the federal government. That's why a lot of tribes have casinos actually in states that don't require it because it's their own land and they're able to do whatever they feel with that land. So as it relates to Oklahoma, I don't know what's going to come of it. Maybe because it's tribal land now, they're going to stop pipelines or they're going to clean every part of Oklahoma. I'm really not sure. But I guess that's what I would imagine would happen. And I would say the same thing for any other tribal nation. At the end of the day, there's just this inherent connectedness to the earth. An example that Michelle will probably laugh at is we're in a group and one of the people was talking about how they were talking to their boyfriend about the earth and the plants. And they were like, oh, this girl was like, oh, the plants are alive. And her boyfriend was like, what? Like, what do you mean? Like, they're just things and carbon and atoms put together. And she was so appalled. She was like, oh my God, what do you mean? What are you talking about? Like for her and for me, it's just so inherent. Like, of course, these are living things and living people. So if we were to get the land back, I don't think that, we would send everybody back where they came from. I think that we would just continue to do what we've always done, which is take people in. Again, the super great example, in Oklahoma of the tribes opening up and saying, our community is your community, have these vaccines. I think the same thing would happen. We would take people in, show them this is how we do things because we've been here for thousands of years. So we must have been doing something right.
And so I want to just kind of touch a little bit on, there's been some comments on that land acknowledgement piece from the universities and what that may do. But Michelle, I saw that you also posted a resource. So I don't know if you wanted to touch a little bit on what that resource is.
Yeah, sure. I just listened to it yesterday and it was a balm to my soul. So I thought I'd share it. It just made me so happy because, land acknowledgements out of the cultural context in which it could be a practice of, a community being able to honor who we are and how we are. Without land back attached to it doesn't really work. So this podcast pretty much rephrases that many times about how performative it can feel without being connected with people and the land, and the land being a relationship that is as important as human relationship. So.
Thank you. And that was sort of like what you were saying. So you just give us the land back. Stop with the lip service. So I just wanted to touch base on that. I do have another question for you. Zoe, where do you see opportunities for intersectional art? Where are the opportunities for multiracial and more multicultural art and otherwise spaces and gifts to be cultivated? And I'm gonna put that in the chat as well.
Ooh, I I don't know if I have a good answer for this. Maybe Michelle has a better answer for this. But I think a lot of the Indigenous art spaces that I've been in, they kind of are inherently intersectional. You know, a lot of us come from different backgrounds. So just the fact that we're in that space makes it intersectional. But I think it's also a very intentional. I kind of touched upon this, but there's a lot of lateral oppression within the Native community. So there are a lot of systemic, just people, you know, saying who is Native and who is not Native. So there are definitely spaces that are not as intersectional, but I think a lot of them are. And I don't think that, you know, anybody's doing it on purpose, just because we're all intersectional, whether that's a race thing or it's because like we have a really large LGBTQ community. You know, it's a lot of things. And I think it's also because, like I said, Native people just embrace other people. So it doesn't, you know, really matter if you have something else going on, as long as you can be there and respect the space that you're in.
Thank you. And I will open it up either for one last question to be asked out loud, or I can just ask it from the chat questions. Okay, so the last question we have is, how can we raise awareness of Indigenous methodology and related practices / programs in our community and apply the lessons learned from these practices to other populations who have also faced historical trauma and oppression?
Ooh, I like that. First of all, I would say use it. I'll go back to the missing data part. If you're not talking about it, then how does anybody know that it exists? When you have a survey, I saw some things about it in the chat, but you know, if you just have other, how do you even know that those people exist? I think that from an academic standpoint, I think we probably just need to involve it more in our syllabi. You know, I would love for there to be an Indigenous methodology course, and that's probably not gonna happen, you know, tomorrow. But even just making cognitive choices to seek out Indigenous articles, seeking out Indigenous programs. And also, I mean, we've already mentioned it, but there are Native people everywhere. So making sure that you're not excluding anybody, which I know can be really hard, but being trauma informed means just knowing that these things exist and naming it. So yeah, I think just being intentional about it, which I don't even want to say can be hard. It's not hard. If you Google Indigenous methodology, it will pop up. So you really just need to make an effort to do it.
Thank you. And that's really all the time that we have for questions. So we thank you so much. That was a wonderful presentation. And for the students, we will see you on our small classroom session. And for everyone else, we hope to see you next week. And thank you so much for your time. Have a great evening, everyone.